Directed payments are one of the largest growing portions of Medicaid spending. These payments are important for many states, and I understand the need for them, but transparency is critical for the public, and policymakers have to have timely access to information on what payment arrangements have been approved and the effects of these arrangements on quality and access to care for Medicaid enrollees. I know you touched on this in your opening, but the Centers for Medicaid and Medicare Services has already done a lot, but maybe we can do more, because both the Government Accountability Office, GAO, and the Medicaid and Children's Health Insurance Program Payment and Access Commission, MACPAC, have recommended bringing more transparency into state-directed payments. My bill, H.R. 8113, the Transparency in State-Directed Payment Acts, does just that. Do you agree that this type of transparency would be helpful? And if so, why?
Appreciate that. Wouldn't be a Medicaid hearing without discussion about state-directed payments, so thank you for that question. For state-directed payments, we have two important goals. One, we want to make sure there's adequate funding for the safety net for providers. And in fact, one of the most common pieces of outreach we have from congressional delegations is how important state-directed payments are to their particular state and providers. And at the same time, as you're noting, we want to make sure we have strong fiscal stewardship. Those state-directed payments, we have transparency, we have oversight, and we know that they're in conformance with federal requirements. And so we have similarly put out in the new rule more transparency requirements on state-directed payments. We think it's important, even if they're really critical, for everybody to have, as you noted, transparency into the levels of payments and how they're funded.
All right, I appreciate that. Are you aware of any directed payments being used by states to push hospital reimbursements to exceed 100% of costs for delivering care for Medicaid beneficiaries?
So as I noted, state-directed payments are critical for reimbursement, and we are making sure we have a lot of federal rules around what states need to do to comply with those, including various payment limits and the like. Part of the new rule that we put out, part of our oversight, includes asking every one of the states those exact sorts of questions and to make sure that all the payments are in compliance with individual rules.
Now, the chairwoman of the full committee brought up the oversight subcommittee hearing on overpayments, and we heard at that time from GAO about the importance of state auditors to detect fraud and improper payments in Medicaid. And one of the proposals that I kind of floated at the time, because it just came to me as we were listening to the witnesses, was perhaps we could get more states to do audits themselves instead of waiting on you all, by sharing some of the savings that they find, and whether it's intentional or unintentional, doesn't really matter, but overpayments that are made, by sharing a portion of that savings with the state. What are your thoughts on doing something like that to incentivize the states to do more state audits?
I think for strong program integrity, you want both people from a federal standpoint, both at CMS and OIG, GAO, being able to take a look, and you want people at the state level that know the individual state-level dynamics and programs, including state Medicaid agencies and others, doing that sort of work as well.
And I appreciate that you want to do it. The problem is the states a lot of times don't have the money for their state auditors to go off and do this, which is why the idea came up that maybe if you shared some of the savings so that if you find, and I don't know what the right percentage would be, but if you find $100, the state would get to keep 20 of those dollars. I think that would then perhaps pay for the program and pay for the states to have auditors and have more auditors going in and checking on these things and make our whole system healthier. Do you not agree with that, at least philosophically?
We'd be happy to work through any details as helpful. One thing I will note, coming from a state, is that when it comes to program integrity, including improper payments, states feel the budget pressure every day. When I was a Medicaid director and someone found a legitimate program integrity piece that I could act on and yield savings and administer the program in conformance with all laws and regulations, I would jump up and down with excitement. States have a strong interest in being able to find things of that sort, and so I think that's why there is both interest and real value in states being able to do a lot of program integrity work.
Well, I look forward to working with you on that, because I do think it's important that we try to figure out a way to do that, and it's just human nature. If I'm going to get a piece of the action, I might work a little bit harder. Not that the chief guy won't be excited if we find something, but if I'm one of the auditors, I'm thinking, yeah, I can really help my state out if I find something that's not being done right.
We'd
think
be
that
happy
just
to follow up with your office
incentivizes.
on that.
Yeah,
Thank you.
I appreciate it, and I yield back, Mr. Chairman.